Hello and welcome, everyone. We are so happy that you are with us, whether it's morning, afternoon, or evening, wherever you are. My name is Niall Kavanaugh, and I'm joining you from the University of California in San Francisco, California, the United States. And we are very pleased that you are joining us today for the UCSF Applicant webinar for the Atlantic Fellows for Equity and Brain Health program. This is our second webinar for applicants to the Atlantic Fellows for Equity and Brain Health program. If you missed the first one, which gives a general overview of the program and includes interviews and perspectives from Atlantic Fellows for Equity and Brain Health, not to worry, it is available on our website at gbhi.org/apply, and you're very welcome to review that following this recording. Today's session is also being recorded, and we will share a link after the event. So our focus today will be on the UCSF site for the Atlantic Fellows for Equity and Brain Health. And we are going to consider and hear from program leadership about what makes the UCSF site unique. We will gain insights into the application process and consider tips and important information as far as what we're looking for in applicants and how to complete the application process. And you will also have an opportunity to ask questions and engage with program representatives. We will reserve time towards the end of our session, which we're expecting to be about 45 minutes today. But we'll save about 10 minutes or so for questions and answers. So if you have questions that you wanted to ask, please feel free to engage with the chat function. And those questions may be addressed in the presentation content, and we will try to take some questions and address those in the Q&A portion as well. I did also want to take a moment to encourage you to learn about the wonderful fellows who make up our community. There are over 300 now, coming from all parts of the world and many different disciplines and backgrounds. And I would encourage you, if you haven't done so already, to check out the Fellows Directory on the GBHI website, just to get a taste and a flavor of the types of folks that are contributing to our community. Hopefully you can see yourself reflected in some of the work of our fellows, but that is another great resource that you can feel free to use to explore and peruse to learn more about our fellows. And with that, I wanted to take a moment to introduce today's speakers. Again, I am Niall Kavanaugh. I'm a communications officer based at UCSF in the United States. And we are also very grateful to have two of our program leaders, two of my personal favorite people, joining us today. Leah Grenberg, who is a neuropathologist and neuroscientist, and one of our esteemed GBHI faculty members, who is originally from Brazil and now resides in the United States, as well as Victor Valcourt, who we'll meet in a moment, who is a geriatrician and the site director for our program at UCSF. And we will start with Victor, who will walk us through what makes the fellowship experience at UCSF distinct. Victor, you are very welcome to join us, and I will pass it over to you.
Hey, thank you. I hope everybody can hear me, and apologize. It looks like my white hair is mixing in with the white top of the slide. But I'm happy to talk to anybody in person, and I will echo what Niall said. There's no better person to tell you about the program than somebody who's been through it. So particularly if there are fellows within your country, reach out to them, talk to them, ask them why UCSF is such a special place to spend a year. And Niall, I think you're advancing the slide, so perhaps go to the next slide. We thought we'd start with a quote from Bruce. Through the training of a new generation of leaders, we truly have a chance to transform society. I think this is fundamental to what we are trying to do by bringing in people who are having impact within their countries, particularly those that might benefit from an experience with us. We feel like we can really advance our global efforts. And I like to tell people that really our strategy is your strategy. So bringing people in who have strategies is really critical to what we do. And then our job is really to accompany and champion those strategies and top up and create community. Next slide. The nuts and bolts of the program is rather similar across both sites, although delivered differently. And I like to say that the curriculum, the core teaching at our site is a minimal part of what you do. It's an opportunity really to discuss and learn from each other. We do not lecture, we try not to. Instead, what we do is provide a lot of information for people to consume before they show up to the discussion, which is facilitated by one of our faculty. So in any cohort, you are the experts, and your contributions really help form what's going on. We create content around these major competencies so that you have something to reflect on when you get into the room. But really, the core of what we want to do is create community and have people inform each other. We don't know the answers. I live in San Francisco. How am I going to inform what might need to be done in Zambia or Botswana or Chile? But you do. All of you live in this space, and so the learning is really group learning. Next slide. We have multiple disciplines. We try to balance this by site, so by year rather. So you'll likely be sitting next to somebody who has a different set of competencies than you do. And this is exciting and nervous, particularly our artists who feel like they're trying to find out where the hippocampus is in the brain. It's probably not that critical because the person next to you knows where it is. Um, at the same time, the neuroscientists wonder, what? I have to do art in the community? Well, why? And you don't need to know that immediately. You'll have an artist sitting next to you who will share with you why artists have such a profound impact on changing the narratives of the work that they are doing. So we set it up for that. We're very keen on our values. You'll spend time at UCSF speaking about one of these values. You're assigned one to prepare with a couple of your colleagues, a 1.5 hour presentation to discuss what is, for example, authenticity in leadership. What does authenticity mean in the cultures around the world that are in the room? And likewise down to courage and empathy and so forth. The next slide now. So the nuts and bolts, you do have a 12-month fellowship. We provide a stipend. The core curriculum will take about 2 hours a week of discussion, but it may take more time to prepare depending on how well you know the topic. And then there's probably another 2 hours of scheduled stuff that includes learning how to write a grant, which we spent a lot of time on, how to give presentations, and also self-reflective leadership learning. We have a curriculum that makes you spend time thinking about your leadership style and how you interact with other people. I think one of the most unique things at UCSF is you will have one mentor, and that mentor will typically have one mentee. That's amazing in any place that I've been to in the world. And our mentors are handpicked across the university because they love doing this work. Many of them meet with their fellows once a week, and many, many emails in between. One of the challenges we have that is a good challenge to have is that the mentors never disengage. So we have mentors at UCSF that are still writing grants with fellows 10 years later, which is absolutely fascinating and fun. And it demonstrates the real capacity we have at UCSF to provide career duration mentoring. We also value very much seeing the lived experience of dementia. So it's a distinct difference at our site that you will spend 8 to 10 months with rotations that include seeing participants in research studies, in clinical settings, in the community, in our various hospitals, and their caregivers who are living through a dementia, sometimes getting a new diagnosis, sometimes engaging in a research protocol. But we think it's critically important for our trainees. Those that don't get opportunities to see this, it's perfect. For those that do get many, we tend to push them into places where they can work on differential diagnosis of dementia. So there's, in my training, I trained at UCSF 25 years ago. And I'm not a neurologist, but in my first year, saw 5, 6 cases of semantic dementia. Many neurologists in the world never see one case. So we just have huge opportunity to learn the nuts and bolts of dementia for those that are clinicians. And we customize your experience so that you're connected to the things that we think most likely will affect your career and your goals. The next slide. Oh, it's already here. You can apply for pilot funds. We teach you how to write a grant. We're very hands-on, lots and lots of editing. As I said, leadership skills. You'll graduate with a certificate from the graduate division at UCSF that you can take home, and you'll engage with the global community, which we foster. So I mentioned already this idea of lifelong membership. I can tell you, and I was late getting on this call because I was on a call with a bunch of alumni that are trying to create a new protocol across Africa. I spend 80% of my time working with alumni to make sure they have all the resources they need to achieve their strategies. I think that's very distinct. It's a dedication of our faculty that we know the impact will be achieved not during the year that you're with us, but in years afterwards. And if we're going to achieve our goals, we need to stick with you. So we really designed a way to do that. We try to connect you in various disciplines through different types of affinity groups, but also I'm quite knowledgeable of everybody's interest across the entire cohort. So I'm always making introductions and trying to scheme on how we can move things together at the same time. There are also lots of opportunities across the cohort, but also as you join the Atlantic Fellow community broadly, we have 300 fellows in this program and over 1,000 fellows across the 8 different Atlantic Fellows programs in the Atlantic Institute. And we can introduce you to all of them. This is a little bit of a map of where we are. We started our work intentionally in Latin America. We wanted to have a regional impact, so we brought in lots of fellows from that area. They now are doing amazing work. I think in terms of the research funding, we've helped them getting funded for $30–40 million from various sources to look at research. There's an active artist group, a photographer, journalist, various people who are trying to change the narratives and working together in that space. And we also have a policy group that's working particularly in Chile and Peru to advance policy. In the past couple of years, we've begun focusing more on Africa. We now have, I don't know, 30–40 fellows from Africa, and we're particularly getting a lot of strength at UCSF in East and West Africa. So we're beginning to scheme ways to bring money to do the work that people want to do there. And again, that's what I was on the last call, and that's what I spent a lot of my time doing. The next slide. The Memory and Aging Center at UCSF is world renowned. It's particularly a center for non-Alzheimer's types dementias. So as I mentioned, the opportunity to see different types of dementia is critically important for a neurologist if they want to be a specialist in their country. As well, for those of you who are not going to be clinicians or specialties in this, it's valuable space to know that a dementia can present, for example, as a language disorder or a visual disorder. So you get all of those opportunities because of the space that we're in. You also will spend time in our community hospital, which serves a large immigrant population. And you'll spend a lot of time in our community, sometimes giving lectures on brain health. If you speak Spanish, you can do them in Spanish. We have a Filipino outreach group. We're working in our African American group. So there's lots of opportunities for you to get involved in the way we do community outreach. We believed in that our research and clinical experiences should be informed by us being in the community. So our faculty spend a lot of time in the community, and you can go with them and do work to really understand the needs within our community, which helps us do a better job at our center, the Memory and Aging Center. Next slide. I already mentioned the mentorship, which I think is very unique. I encourage you to find another situation where you can have such intensive opportunities for mentoring. I mentioned the complex cases. And our environment at UCSF is novel as well in terms of neuroscience. Our neurology department brings in more research dollars than any other neurology department in the US. So it's a robust place to learn just about any aspect of research that you might want to do. And we have an amazing staff. It reminds me to say that we recognized years back how challenging it was to onboard, to come across the world and begin working at UCSF. So folks like Stacy and Alessandra and others on our staff have done an amazing job revamping the onboarding experience, which includes a loan that some fellows are able to access because they need a little bit of money to even put a deposit on an apartment. Having the certificate gives people access to dorms, so most of our fellows now live in student dorms, which has helped tremendously. But our staff are there to help at every step. There's a large community of creativity. Our Memory and Aging Center actually has a band. So if you play an instrument, you'll be called to be in the band, or if you sing, or you'll be called to be in the band and have some informal opportunities. But we have had a grant from the city of San Francisco to provide creative activities for elders now probably about 5 years. Most of our fellows who are interested in this space love this space, and they end up doing all kinds of art activities. Currently, a fellow is painting a mural. We have another fellow who's taking primary narratives of caregivers in Spanish. This fellow is a journalist. We have fellows from 3, 4, 5 years back that continue to work through Zoom. One is doing dance exercises with this program for elders. So there are just a tremendous amount of opportunities. We also have a gallery. So the visual artist, we have one of our fellows currently has a gallery showing and of his work from Uganda. So there are plenty of opportunities. We work with the San Francisco Conservative Music and have done a number of different events with them where we mix science with music. These are usually oversold, over 400 people. When we were on Zoom, over 500 people attended. So lots of arts opportunities. Next slide. I think I've hit most of all of these things. So Niall, maybe the next slide. I think I'm just about done. And I'll just share that my email is available on the website. Write to me if you want to have a one-on-one conversation. I'm always happy to share more. Thanks so much.
Thank you so much, Victor. We are very grateful for your insights. And before we welcome our next speaker, I just wanted to encourage those of you that might have questions related to perhaps some of the content that you just heard or other things you're wondering about our program. Please do feel free to use the chat feature to submit your questions. And we will do our best to get to those either via the chat or through our Q&A session towards the end of our time together. So next, I would like to invite in a GBHI faculty member, Leah Greenberg, who will share with us ideas related to the application process, selection criteria, and what we're looking for in our applicants. So Leah, you are very welcome to join us.
So my video is disabled by you, so I think you have to enable it. All right, here we are. And it's great to be here. I'm sorry I cannot see you all, but I can see we have a lot of people in this call and there is a lot of excitement. And I think it makes sense because GBHI is very excited. So Victor talked a lot about what the program can bring in terms of benefit and how this is a worldwide network and together we can move forward much better, which I totally agree. And I will talk more about the logistics. So probably many of you already started your application process or you are considering to do it. And we are trying to do it as easy as possible and provide you as more objective information as possible so you can fill the application with the data that we need to see. All right, so let's talk about eligibility first. So who can come to our program? So first of all, you need to be available to complete a 12 months full on time in residence education. It means that you will move to San Francisco to get in the program. I mean, many of you are asking, can I bring my family? So in most cases, yes. People come with their families, some people come without the family, or whatever works better for the fellow. But it's important to notice these 2 months are here in San Francisco. Usually it starts in August. So now we are running applications for the program starting in August 2026, 1 year from now, and it goes until August 2027. And the program, again, can be hosted either at UCSF or at Trinity College in Dublin, Ireland. So in both cases, again, you either be in Trinity or in San Francisco, and the application now is done separately. So you have to do your homework to understand which one of the sites will be a best fit for you. We try to provide a lot of information about what each site can provide, and Victor just mentioned some of the strengths at UCSF, so you can apply. But there are, of course, many parts of the program that we do together. But parts are different, and each site is different. And you have to be proficient in English. So at least here for the US, it means that either you have a certificate, there is a list of certificates that you can obtain, or there is an interview in English, and we fill a form stating that your English is adequate to come to the program. Okay, I can move to the next one. Another thing that it's very important, and we do pay attention on this when we do selection, we, in our experience, we realize that applicants who have a regional support, they are more likely to be successful when they come back. So what a regional support means, it means that either you had a mentor or you have a more senior figure that you have been working with that will commit to help you to establish your program, to introduce you to people, and to help you to deal with problems that might happen. Maybe it's the ethical committee approval. Maybe there is someone who is jealous of you, you know, something like this. And so in your application, you have the opportunity to submit letters of support. So in these letters of support, at least one of them, it has to be from someone who is stating that will provide this kind of support to you, and they should state how they will provide the support to you and how you are working together. This is not necessarily financial support, but it's, let's say you are in a university, it could be someone saying that you have your space back when you are back. You have protected time to apply your project, or it can be someone that's not your university. Maybe you are not in a university, but it's more senior and well connected in your field, and it's living in the region where you are that will provide this kind of support. All right, so what about the level of education and training that we are hoping to have in your most competitive fellows? So usually fellows, they need to have highest degree or associated training. What does it mean? It means a master, it means, sorry, a PhD or a doctorate, or a medical license, or a law license. We did have some fellows in the past that only had a master degree. We look case by case, but usually this does not meet eligibility. Saying that, not everybody have a traditional academic pathway. So this is why we are providing this table here, showing specific eligibility criteria for different areas and professions. So for instance, on the first column, we talk about artists and other professionals. So not always, and many times, artists and other creative professionals, they don't have a PhD. Sometimes they do, but they have to have a portfolio. They have to have already some track record of interest in improving the lives of people living with dementia and the care partners. And usually they have a public platform to show their work or portfolio. It could be, exhibitions in galleries. It could be collaborations with a museum doing activities. It could be a podcast or a radio show. It doesn't matter. But so again, in this sense, this already establishment in the field, it comes in view of a doctorate. But it's important to demonstrate this. Now, for physicians, again, an MD with usually residency, so we would like to see people that are ready towards the end of their training, or even a fellowship. And of course, that can demonstrate to have an interest in improving clinical practice. Now, for researchers, especially those who are in academia, we will require a PhD and postdoctoral training. And again, approve that there is a approved track record of interest in generating and distributing knowledge, especially related to fields that promote equity. So the GBHI, it's a program that is not the greatest fit for someone who has a very traditional academic trajectory. Oh, I'm in the lab, I'm trying to develop this assay, or I'm trying to learn something new about the disease. This is very important, but this is not GBHI. GBHI is more appropriate and can serve better those who are doing this, but with this eye of how can I distribute this assay in an equitable way to people that do not necessarily can pay a lot of money for this, and how I will work with the health services to make it happen, or collaborate with people who are there to make it happen. And usually people who are doing this, they already have a track record of having done that, not necessarily in the area of dementia, but it's important to demonstrate this impetus to go, the extra mile and promoting equity in the work you for the population based on the work you are doing. And of course, there is the category of innovators, entrepreneurs, policymakers. Usually, again, this category won't necessarily have a PhD, but will have a track record of significant expertise in the field and record of achievement. And we want to hear what it is. Great. So when you go to the portal, you have to answer a lot of questions. You have to answer questions about your personal information, your education history, your professional history, where did you work. A very important one is a statement of purpose. So why do you want to be in this program? And of course, a resume of a CV. Now, this is my experience, and this is something I would like to talk about based on my, all these years we are doing selection. We know that many people, they want to bring the best application. English is not necessarily the first language, and even when it is, communication is important. And since a few years, we have tools like ChatGPT, Gemini that help us with generative AI to improve the applications. And this is okay to use. We welcome to use it. But we have seen applications before in which the candidate will put the question asked and ask ChatGPT to bring an answer. And usually these answers are very generalizable, so they are not personalized, and we can see that there is nothing there. I mean, they are a lot of beautiful work and they are empty. So when you write your statement of purpose, it's very important that you explain exactly why for you, that you link it to your past achievements and things that you are doing already in a way that we can see clear examples of what you have been doing and what you are doing now. Even if you use ChatGPT, it really makes your application stronger. And you need 2 letters of support, and we'll talk a little bit more about it. The deadline is September 19th, so you still have over a month to work on this, and I think it's time enough. All right, so let's talk about the letter of support. So I mentioned that one should be from a current or past employer, institution, or organization. The letters of support are supposed to be from professional contacts. And at least one of them has to be from someone who will provide this regional mentoring and sponsorship when you go back. So it will make your application stronger. I mean, if you reach out to someone very famous in the field that just know you tangentially and ask for a letter of support, and the person will say something like, well, I met this person a while ago and I was impressed if this person is doing, but really doesn't have a skin in the game with you, usually it's not a strong letter of support. Another thing we try to avoid, and we do receive this kind of letter of support, so we want to get a letter of support in the style that is a letter of support in the USA. So what it means, it's a letter of support that really speaks about you and why you are the right candidate. It's not a confirmation that you had work in a certain place or in a university. We have other ways to check it. So it's not a letter of support from your boss saying, I affirm that this person has been working in this department for 2 years and is in good standing. This is not a good letter of support. Again, I will repeat again because I think this is the most critical part. You have to have letters of support of someone who really know you, who really can support you and can speak about your commitment to promote equity, about your work ethic, and about your fitness for this program. All right, so this is the website, gbhi.org/apply. And then this arrow is showing you apply to the fellowship, and this is where you can start your application. One thing that you should know is that you can start an application, save, and come back later before submitting. So you don't need to have everything ready to start filling the forms, and we suggest you do it before the last day because it gets very busy and you can have some problems with outage, electricity, so do it early. All right, so going back again to a letter of supports and more logistics on how to apply. So we recommend that you contact your letter of support writers earlier and you confirm with them that they can submit this letter of support before the deadline. So you will fill the application for you, and you will mention in the application who is giving you the letter of support, but the actual letter of support has to be submitted by the person who is giving the letter. It's not that the person gives it to you and you submit. It's a different system. So again, you need to make sure you contact them early, and you need to make sure to confirm that they know the deadline and that they submitted it before the deadline. Okay, so in this slide, we have more instructions on how to do it. So you go to the application, you put the contact of your writers. The writers will get an email with a link, and this is where they will upload their letters. But again, it's your responsibility to make sure they upload it before September 19th. All right, some application tips that we think it's important to cover based on what we saw in previous years. So we have a stage in the application process that we do administrative review. Applications that are not complete, they are discarded even before review. So maybe you are amazing, you are a star, you should be in the program, but if the application is incomplete, we won't even have the opportunity to be reviewed. So please put a lot of attention in these details. You can only apply once per year. You cannot send 2 applications, and you cannot apply to UCSF and to Trinity. You can apply it either to UCSF or to Trinity. Okay, it's better to use a computer because it's a long application and you have to write like the statement of purpose, etc. So it's easier to do in a computer. And again, you can save your progress and continue later, of course, before the application deadline, if it's easier for you. All right, so this is another thing we recommend. So rather than writing your statement directly in the form, it's better that you do separately. So you can check the text, you can check the orthography, can save it, and then you copy and paste in the applications. Applications must be submitted in English, but also it's important to notice that we have one category for French citizens, and they have a category that is funded by the French Foundation Alzheimer Atlantic Fellow Partnership. So in this particular category, you have to answer specific questions for the French Foundation. So if you are in this category, please make sure to fill these questions. All right, so let's talk about the selection criteria. I already spoke a lot about it, but it's good to have this slide so we can summarize. So what we are looking for, again, someone with a strong personal mission that aligns with GBHI goals and commitment to brain health. So there are many good examples about it, but the most important example of people that don't fit this category, but we still get a lot of applications, are those who have a very traditional academic trajectory that should be doing a postdoc and not a GBHI fellowship, a regular postdoc. We want to see bold creative ideas, don't be shy about it, but we want to see a general plan on how you think you'll make it happen. It doesn't mean that you have all the resources to make it happen. This we can help you to get, but that you have a plan that what you need to make it happen. All right, so we want people who are ready to lead change in your community and grow as a leader. We hope that this program will help you to go from here to pivot your trajectory. We are very much interested in team players because we work as networks. So when you write your application, it's good to mention how you are a team player, maybe some examples, especially if you are leading teams. And we want to learn about your plans 5 years after the fellowship. The fellowship is not a good place for taking a pause and decide about the future. It's a good place maybe to pivot. Maybe you're doing something, you want to change to something different and it's aligned with GBHI. So GBHI might be a very good platform for this. But we want to see what is your plan for the next 5 years. Now, people may say, well, I'm in a university that have a very difficult process to bring people as faculty, like a context is a public university. I don't know if in the next 5 years I will be able to get there. We understand that, but we want to hear what are you doing, or what are your plans, and what the support you have to make it happen. Okay, and of course, people who have strong ties with the community, because the idea of GBHI is that you will make projects that have direct impacts on the community. So it's important to have ties there. Could be with community, could be with community leaders, but we would like to see real and active relationships. All right, so after you submit September 19, what happens? So you'll be notified if you are invited to come to an interview in November 2025, and only selective applicants will be invited for an interview. So not everybody come to interview. Now, if you are coming to an interview, you will probably be interviewed by 2 or 3 people. This happens by Zoom. And it happens in this period between November and December. And we hope to have all the decisions made before the end of the year. So usually before Christmas time. All right. So again, summarizing, start early, clarify your purpose, why GBHI, share your project, we want to hear your ideas, show how committed you are, not only how committed you will be, but how committed you are already. Highlight the relevant experience for GBHI, choose the right host site, and choose well the people who will provide you with the 2 letters of support. All right, so I think we have time now for questions and answers.
Yes, absolutely. And thank you so much, Leah, for the wonderful overview. We will have Leah available for the question and answers, and we'll welcome Victor back to the conversation as well. So please keep those questions coming into the Q&A feature on Zoom.
Now, I wonder if I could make a general. I've been trying to respond to a lot of the comments. And sometimes they get into kind of more personal, like, would I be eligible if I am a such and such? And quite frankly, it doesn't matter what your training in necessarily is. And we've had fellows who come in with an entire training, but their impact portfolio is stuff they do, at night and on weekends, and they're highly engaged. So I put less emphasis on what you do and more on what you want to do, what you are doing, what you have done in this space. And that can create a compelling story. We've had, anthropologists, we've had lawyers, we've had journalists, we've had, researchers, we've had policy people. What you're doing is kind of a little bit less important. And that speaks to another comment that came into the chat. And Leah knows this very well because we do report on where your discipline is. But it's almost impossible to do that because many of our fellows have substantial intersectionality. That they may be, in fact, some of the biggest policy people we have are neurologists, and they are engaged in the Ministry of Health. So if we label them as a neurologist, we would be missing a huge amount of where their impact is, which is in policy. Many of our neurologists are artists. It's surprising, but it's true. And they're having, we even had a neurologist who had an art display at a Gallery 180. And part of their impact is through art. So I would put that a little bit to the side and think a little bit about what drives you? What do you want to do? How are you going to convince us that this is the most important thing? And lean in on that more than precisely what your current labeled profession is.
Thank you, Victor. And perhaps building on that, if I may ask a follow-up with a question that came in, and you talked a little bit about what the year looks like for the fellow, but there's a question about what kinds of projects do fellows typically work on during the year, which you've spoken about a bit, but I'm curious if there's
Yeah, I love that question because I do want to know what people are going to do when they're with us. And 50% of your time is free. We don't book a lot of time. We want you really to advance your projects. So when I onboard our class coming in, which I did last month, I am asking exactly what do you want to do? And sometimes it's get involved with the community and do, dance theater, do, stuff. And I connect them very quickly to a Creative Minds group. Sometimes they say, I have this data set I've never analyzed, and then they get linked tightly to me because I do a lot of accompaniment to write papers. Sometimes they say, I don't know, I want to be an academic, and then I say, well, you have to publish. That's the currency of academia. You got to publish. And we start thinking about what you're going to publish. Do you have data that you're bringing with you? Do you have data in large data sets you can access? Or will we need to match you with a mentor who has data and can work with you to write a paper? For people who are highly successful, they publish 2 or 3 papers when they're with us, sometimes on their own data and then on other data. Sometimes people say, I want to be the best clinician for dementia in my country. And we link them immediately to our PPG project where you see all kinds of dementia. We get them in early so that all year long they're seeing clinical cases after clinical cases after clinical cases of atypical dementias. So it varies, but we will work with you. We do not want you complacent while you're with us. We want you active. And we don't want to be policing you. We want to set you up for success and then let you self-drive. And all of the fellows who come to UCSF hear from me the first day that this is a gift. I'm not policing you. If you don't show up, it's your loss. If you show up and you ask, I will connect you as much as I can to make this year the most effective year you've ever had.
Thank you, Victor. And of course, the fellowship, I mean, we consider this a lifelong fellowship. It's beyond kind of the in-residence year, but there seems to be a lot of interest in what the year in San Francisco is like. You touched on this a bit earlier, Victor, but perhaps you might like to expand or emphasize or reiterate. But there's a question about, is there a stipend and is housing provided for fellows living at UCSF?
See, maybe Stacy, is Stacy
Yes.
able to answer that question? She probably will be more accurate. I could talk with if she's not available, I can talk about it, but I think she would know it better.
Yeah, well, and perhaps I can share on her behalf. But fellows do receive directly a basic salary commensurate with the cost of living in San Francisco, which generally supports one individual. Again, as Leah had mentioned, sometimes we will have fellows relocate with families. San Francisco is kind of notoriously has a high cost of living, but the stipend generally provides for one individual to be supported. And that specific number would be made available at the time of acceptance. And the fellows at UCSF are considered students. I think this came up a little bit earlier, but just to reiterate that means they're eligible for UCSF student housing. So the majority of our fellows, about 90 to 100% of our fellows, opt to live into UCS student housing, which generally they have found to be comfortable, convenient, either on or close to campus. So
I'll add that the stipend is linked to our other training programs for equity reasons. So our fellows are paid the same amount that our clinically trained fellows in the US are paid. It's a postgraduate year 5 actually, standardized number across the University of California, San Francisco. And it typically has been in the 80s, 80,000, 85,000 K. It's enough to live on. It's hard to live with family on that amount of money. And the dorms are competitive, but we've not had problems if people apply early. If you wait until July, you're probably going to have to find some other housing. Or if you don't want to live in a dorm, you'll need to get going early and start looking. It's quite challenging to find something you can afford on that stipend.
all right, and we are moving toward our close and toward the end of our program. I know we're a little bit over the 45 minutes that I had suggested, but I appreciate you all staying with us. And perhaps we can close with this question. And Victor and Leah, I'd love both of your thoughts on this one. I think I'm thinking earlier of Victor's comments about him spending 80% of his efforts on working with our alumni, which is so much of our work. So this question has come in: how does the program support fellows in making a real world impact in their home countries or communities?
Yeah, I love this question too. If you don't mind, I'll answer this one. I have a philosophy, and I think it's a philosophy that we kind of hold at UCSF in general across most of the faculty, that our program should not be the person doing the work. We're not affecting the change. In fact, this has been a historical challenge when people from the global north are trying to solve things in the global south. So our philosophy is really that the fellow is at the center of change. So you need to tell us. I'm about to talk to our current fellows this afternoon, and I was thinking about it. The people that come to my office on a regular basis will probably still come to my office on a regular basis when they're gone. I have fellows who I'm meeting with every month and moving things forward, and others won't. They're quite independent and they'll move forward on their own. I'll take whatever your level of engagement is and move with it. Mostly, I'm trying to find networking and I'm trying to find funding sources. So whenever I can connect people to things, I do. And whenever I can find a way that we might be competitive at getting funding from other sources, then we dig in. We also dig in a lot on, and anytime we get an opportunity, particularly if there's funding included. Our program does not fund things. So if you're expecting us to give you money afterwards, it's unlikely. We do fill gaps where there are places that we think if we throw in some cash, we can get 3-4 times as much cash from another agency. We've been successful with that, highly successful. As part of why we have such a large portfolio in Latin America and I think now in Africa. But we're not a granting agency. We're a fellowship training and then champion agency. So in the alumni space, we'll let you drive what is going to happen. We won't be telling you you must do this, but I might suggest to you, I see this opportunity. Do you know John, who's across the, in the other side of your continent, working on the same thing? Can I introduce you to them? There's somebody in another fellow doing this. I heard there's a conference happening. I think you'd be a good speaker. All of those things is very active in your alumni time. Leah, do you want to add anything to it?
I think I agree with all this, but I also want to speak about the individual experience with the mentor at UCSF. So we started the program almost 10 years ago, and again, we all mentor students, and I will give my personal experience. I have been still working with my previous mentees and the current ones in a current basis. Of course, they are at different levels, right? People who are coming now, maybe they are learning to interpret data or writing a paper. And people who came years ago, they are leaders of large grants and they participate in large consortiums. So I think there is the strength of course, the group and the network, and of course, all the support that Victor, you mentioned. But as Victor mentioned at the beginning, and I think this is very important, it's really a gift to be matched to a one-to-one mentorship experience, right? Because this is really a relationship that goes way beyond the program, and it helps not only for the practical aspects, how to write a grant or support something, but even career advice or some crises we have in the middle of life. Are we doing the right thing? Is this the right direction? So it's the kind of relationship with someone that is experienced and has interest on you and interest on your success, and can help at least brainstorm, if not guide the process. I think that it's a very important thing at GBHI.
Wonderful. Thank you, Leah. Thank you, Victor. And before we move to close, I just wanted to address one final question because it has come up several times, so I didn't want to leave it out there. But there was a question around if applicants can reapply if they had applied previously and if for whatever reason they were denied or weren't able to participate. To clarify, applications are welcome, or reapplications, I should say, are very welcome. In the application, we would ask that you describe any relevant developments regarding your career or skills or experience since the previous application. It should not be the same application that's resubmitted, but you are very welcome to reapply, again, noting any changes since the last application.
Our program has become increasingly competitive. I think in the first year, the rate of acceptance was higher than it is now. Now we really get to the point where we have 30, 35 people we want to bring to the site. And then we have to really make difficult decisions about who's going to get the most from the program, what regions are people working in, who are they working with? So the fact that that somebody might not have gotten in, there's so many factors that could have been considered there. It might have been a very competitive application that just was in a pool of highly competitive applications, or there are other situations where they just weren't as well aligned. I would encourage you to reapply. There's absolutely no reason not to, and I would encourage you to talk to other fellows. Look carefully at our website. Look at the types of fellows that are accepted, what kind of work they're doing, and that might inform the application as well.
Wonderful. And with that, we'll thank Victor and Leah for your insights and your expertise. And I would just invite you can feel free to turn your cameras off now as we move to close. So this brings us towards the end of our session today. I did want to thank you all very much for joining us today and for your interest in the Atlantic Fellows for Equity and Brain Health at UCSF. We truly hope that you consider applying and that we see you in San Francisco soon. You can learn more about the application process at www.gbhi.org/apply. And also remember that the recording of the first webinar, which gives a broader overview of the fellowship program and includes perspectives of a couple of fellows, that's available there. This recording, this webinar will be shared with registrants and posted on that same page in our YouTube channel as well. So feel free to have this and know that this resource will be available for your review and perhaps for sharing with others that you might consider as a potential fit for our program. If you have any questions, don't hesitate to reach out. We have an email address that is posted in the chat, which is gbhiapply@ucsf.edu. We do have a very thorough apply page on our website, but if anything is unclear, don't hesitate to reach out. Yes, so with that, wherever you are in the world, we wish you the best in your journey. And I also wanted to just take a moment to remind you that we will be hosting a webinar for Trinity Applicants, which is our sister site, on the 20th of August. So just a couple of weeks away. We encourage you to check that out as well, so you have a better understanding of what each sites offer. And with that, I will just say take care, and we hope to hear from you soon. Thank you so much.